Hello and good morning and welcome to the tip of the day. I'm Dr. Amy Starr with the Mesa Veterinary Clinic, Paws and Hooves Mole Veterinary Services, and San Francisco Stables. We're helping El Paso help their pets. So this week has been kind of weird with weather. We've had some really cold nights and some warm days, and then it gets cold in the afternoon and so forth. So unfortunately, over the past couple of weeks, I've seen several of our older equine patients, equines are horses, for arthritis, and they get very stiff, they lay down, they can't get back up, they need help getting up. I just went to another one this morning and one on Monday and so forth, and so we're seeing a lot of this, so I thought I would make it into a video tip. So those of you who don't have horses, hopefully this is interesting to you as well, because it does pertain to all of us, even our cats and dogs and potbelly pigs and everybody. So basically arthritis obviously is an issue. It gets worse. It's always progressive no matter what we do. But there are a lot of things that we can do to keep our animals and our pets comfortable and managing well enough to have a good quality life, and to also slow down the progression of the arthritis a little bit. So I wanted to go over some of the symptoms that you might see of arthritis, and then also some of the things you can do to manage it. So the symptoms are stiff walking, laying down more than normal, having difficulty rising after they have been laying down, not wanting to move around as much, maybe resting a certain leg much more predominantly than the other legs, and so forth. And so we do want to keep our older senior arthritic pets moving, because that does keep the joints lubricated and helps with all the movements and stuff, and so that is important. But we can also do other things to help keep them comfortable, and so there's a whole wide range of different modalities that are recommended, from moderate exercise, to one of the most important things is keeping the weight down. So we do not want them to be overweight. That extra weight, fat cells produce inflammatory cells or components, and so that increases the inflammation. Also, the weight adds extra pressure onto the joints, and so we do want them to have a nice muscle mass, which is difficult in older pets, but we also want to keep their actual fat cells and weight down. That is one of the most important for all of our species, whether they're the small animals or the larger animals, and the potbelly pigs and stuff as well, which we do see a lot of arthritis in. Another thing is glucosamine. So there's lots of glucosamine components out there. For the horses, I recommend either Cosequin ASU or the platinum brands. And so those are a little bit expensive, but they do have the components that we're looking for. So if you're looking for something, you want to make sure it has glucosamine, chondroitin, MSM, and ASU. Also, some of the other things like grapeseed extract and things like that are very helpful as well. That you need to give every single day. Don't miss a day, and give it for the rest of their lives. And it can help reduce some of that progression of the arthritis. And it does take about 4 to 6 weeks for you to see a difference in your pet. But whether you see it or not, go ahead and continue it. It's very important. The next thing is natural anti-inflammatories. So there are a lot of products out there. The one that my client that I saw this morning is using is one that she found at Tractor Supply, and it's called Devil's Claw Plus. And it has turmeric and devil's claw and yucca and boswellia and all of those things that are extremely helpful to reduce the inflammation and pain. And so if you do have an older arthritic patient, instead of trying to place them on medications like Butte and stuff like that, we want to try and do the natural anti-inflammatories first. And they can take those every day as well. The next thing is Daquan injections. There's lots of products out there, Daquan, Legend, Icon. Basically, they all help the joint health and help to lubricate the joints, add some shock absorbers, and try to protect and seal those cartilages. And so Daquan is always a good idea, and it is a little bit difficult because you have to give it very frequently. They are injections for the first 7 treatments, but then it's just once a month after all, which is very doable. The next thing is acupuncture. Acupuncture is great and helps with the discomfort and mobility and such. The next is massage. Then you've got chiropractor work and laser therapy. I highly recommend laser therapy for pain and inflammation, swelling, and you know, basically joint issues like that as well. And then we get into some of our medications, which we can do, like bute and other such things. But it's important to try and add on all of the non-medication modalities first so that we can keep our other organs as healthy as possible as well. And remember that moderate exercise is good to keep those joints lubricated and get the medications into the joints, but we don't want to overdo it. And so if you have any questions, if you have a pet that's having a hard time, let us know. We're more than happy to take a look, and I hope everybody has a great day. Bye-bye.